Good morning, everyone, and welcome to this podcast about variants of dermatofibroma. As we all know, dermatofibroma is the most common cutaneous soft tissue tumors. The diagnosis could be easy clinically, especially if we have a positive dimple sign. Otherwise, dermoscopy could help. Dermoscopic analyses vary according to the patient's characteristics, mainly the phototype and location of the lesion, the device and dermoscopy technique used, and also the histological subtype. Here, I want to emphasize the importance of using immersion and polarization in order to see these pigmented structures and also white shiny structures. The most common pattern or variant of dermatofibroma is the common fibrous histiocytoma, but other variants were described and we will see some of them during this webcast. What is important to know is that structures of different variants could be present in the same lesion. The most stereotypical and common dermoscopic finding of cutaneous fibrous dermatofibroma is the pattern of pigment network and central skull-like white patch. We can have also in the center central pigmented clothes or white network. This pattern is frequent in Occidental studies, the study of Agiro and the study of Zabalus, but it was less frequent in dark phototype, especially in our study. Other dermoscopic patterns were described concerning this common fibrous histiocytoma. And as we see here, we have a typical peripheral network formed by these ring-like structures and a central skull-like white patch. We could have here also what we call a spitzweb pattern of dermatofibroma with a central star-like patch. Other pattern of common fibrous histiocytoma is the total pigmented network or the lentigo-like pattern. Here on clear phototype and here on dark phototype. Some authors, like Zabalus and all, consider it as the first stage of evolution of this tumor. In our publication, we have found in some patients, especially in very dark phototype, the presence of perifollicular accentuation as a pigmented rim. Other dermoscopic patterns were described in this common fibrous histiocytoma, and here we have seborrheic keratosis-like pattern, and here a pattern with pigmented network and homogeneous pigmentation at the center, and here just homogeneous pigmented area. Other patterns, and here we see these star-like white patch at the center and pigmented peripheral network, and here these white linear white patches forming another white structure and peripheral network. And we can have also what we call a multi-component pattern in this type of dermatofibroma. Another variant of dermatofibroma is what we call hemozygotic variants, and it probably represents a stage in the development of aneurysmal fibrous histiocytoma. They are both deep and may involve the subcutis. In histopathology, we find numerous vessels, extravasated erythrocytes, and intra and extracellular hemosiderin deposition. Upon dermoscopy, we can find pink bluish pigmentation with the presence of dotted vessels and coma-like vessels. Other examples of pink-brown pigmentation with dotted vessels and coma-like vessels. Here, a case of aneurysmal dermatofibroma, and you have found in our study that this variant or subtype of dermatofibroma is mainly found in men and in large lesions. And we usually see ulceration in this subtype of this tumor. Upon dermoscopy, if we have ulceration, we have described a dermoscopic pattern which characterized by a white ring around the ulceration with radial, dotted, and linear vessels around the ulceration, as we see here. And the ulceration is mainly due to this hemorrhagic space without endothelial lining. This is a giant case of aneurysmal dermatofibroma, where we see here clearly the white ring around the ulceration with white shiny structures and linear irregular vessels. A recent study characterized 7 different patterns of hemosideretic aneurysmal dermatofibroma, but I find it difficult to characterize them. In general, we find bluish, purplish, homogeneous area with white, shiny structures, and we can find also discrete peripheral network. And if we have vessels, we can see the purple color. And here, in their publication of these authors and our publications, we can see clearly uh, the white rim around the ulceration as we have described it years before, and also the white shiny structures. Another variant of dermatofibroma is the atrophic fibrous histiocytoma. It could be evident clinically because we see the depressed plaque, and it could be the end stage of the last stage of evolution of dermatofibroma. Upon dermoscopy, we can see a white star-like patch or a patchy pigmented network which resembles to a fading network with multiple white patches. Here we see the fading network and white shiny areas, and here we have a central white star-like patch. These are two curious cases about atrophic dermatofibroma. We see clearly clinically the atrophy, and upon dermoscopy we have a seborrheic keratosis-like pattern. Multiple white patches could be also uh, described in this keloidal subtype of dermatofibroma. Another variant of dermatofibroma is the lipidized variants, and upon dermoscopy, we see clearly the yellow color. It could be mixed with other patterns in dermoscopy, and we can have also what we call the sunset pattern that we can find in xanthogranuloma. This is a BCC-like pattern with arborescent vessels and peripheral globules. This is an atypical aspect or variant of dermatofibroma. Arborescent vessels on a yellow background could be seen in sclerotic variants of dermatofibroma, And the differential diagnosis is mainly the solitary sclerotic fibroma, as we see here in this figure. I hope that this podcast was informative and I thank you for your attention.